Okay, today lecture of pharmacology topic cholinergic drugs. What is the cholinergic drugs? Cholinergic drugs are similar action to acetylcholine by the directly interact with the acetylcholine receptor. Okay, what is the acetylcholine? Acetylcholine is the major neurotransmitters of the parasympathetic nervous system. The cholinergic nerve having the neurotransmitters that store, synthesize and release in a presynaptic cleft. After then reaches in a after the release then reaches to the postsynaptic cleft. Okay. The important acetylcholine releasing sites: autonomic nervous system, ganglions, postganglionic nerves, and adrenal gland, brain, spinal cords, and the neurotransmitter junction, sympathetic, postganglionic, sweat glands. These are different from sites where the acetylcholine are secreted. Okay, acetylcholine are secreted. Okay, that after synthesis, how to synthesize the acetylcholine in a synapse? First of all, acetate ATP energy, acetate and ATP energy and coenzyme bind to each other and produce the acetyl coenzyme A, acetyl CoA. After the choline bind, then converted to acetylcholine in the presence of choline acetyltransferase enzyme. Okay, and after the potential of presynaptic cleft that present in results of presynaptic cleft, after exocytosis, the cholinergic neurotransmitter means acetylcholine are released in a cleft. Next, this is the diagram how to synthesize the acetylcholine. This is the presynaptic cleft and this is the prosynaptic. That are the nicotinic or muscarinic receptor. Okay. Acetyl coenzyme A are synthesized due to the presence of due to in a previously ATP acetate and coenzyme A formation acetyl coenzyme A, and after binding to choline and the presence of choline acetyltransferase and converted to the acetylcholine. Acetylcholine are stored in vessels after the release by the exocytosis process and ultimately reaches in a synaptic cleft, and after then bind to the postsynaptic, that conduction of neurotransmitter occur. Okay. Yes, like in a different drugs can be inhibit the synthesis of acetylcholine, like hemicholine, that is a chemical that inhibit the reuptake acetylcholine in the presynaptic cleft. That's why decrease the concentration of choline. After the synthesis of acetylcholine are inhibited. And similarly, postsynaptic cleft toxins, deuterium also inhibit the exocytosis of the acetylcholine. Okay. That finally I discussed about the how to synthesize the acetylcholine in a presynaptic cleft after releasing in a postsynaptic cleft, releasing in a synaptic cleft after the postsynaptic cleft. But one enzyme, acetylcholinesterase, after some time acetylcholine is broken down choline and acetate by the presence of acetylcholinesterase enzyme. Okay, next slide. This is the different of cholinergic receptor, that is muscarinic receptor, nicotinic receptor, muscarinic receptor. I also divided in 5 types, subtypes: M1, M2, M3, M4, M5, and nicotinic receptor also divided in 2 types, that is known as M, and NN. That is receptor. The muscarinic receptor are transducer mechanism induced due to the G protein couple receptor. Okay, and after that, this is the muscarinic receptor, and it having the M1, M2, and M3. That M1 is G protein receptor IP3 deck pathway. After finally increase the calcium level in protein kinase that induce the contraction. And M3 the cyclic MP pathway inhibition due to dephosphorylation. Okay, dephosphorylation after the potassium channel open and after the relaxation in cardiac muscle because M2 is present in a heart and M3 is the smooth muscle. These are receptors located in different positions of the body. That M1 receptor in CNS and M2 in a heart and M3 is smooth muscle, M4 and M5 in CNS. So then you know how to effect on the different portion of the body by the muscarinic receptor, by the acetylcholine drugs, because acetylcholine drugs are bind to the muscarinic receptor and nicotinic receptor. After the transducer mechanism, that the in M1 that is the contraction occur, M3 relaxation occur, and M3 also, M2 relaxation occur, M3 also contraction occur. Okay, next slide. The different classification of the cholinergic drug, that the cholinesterase, that is acetylcholine, methacholine, and the carbon called methanicol, and cholinomimetic alkaloid drugs that have the pilocarpine and mescaline. After that, these are drugs are act as directly on a receptor. But anticholinesterase, what is anticholinesterase? Anticholinesterase is the drugs that inhibit the cholinesterase enzyme, because cholinesterase enzyme breaking down to the acetylcholine in two part, choline and esterase. That's why acetylcholine is the destroyer, in which the anticholinesterase enzyme protect the acetylcholine and in a synapse, and that having the good effect of acetylcholine. Otherwise, cholinesterase enzyme is broken down to the acetylcholine. Okay, the different type of these drugs act indirectly to the indirectly, and that promote you can say the promote enhance the concentration of acetylcholine in a synapse for the beta action of these. Okay, that reversible neostigmine, physoestigmine, pyridostigmine, and androphonium, that is reversible, and short acting rivastigmine and domeprazole that act as the CNS. Okay, and irreversible organophosphate, that melanothion, toxic gases, serine and tabunin. Okay. What is the pharmacological action of acetylcholine? Actually, and the muscarinic alkaloid are present in the first is present in the CNS activity. Okay, next slide. That is the cholinergic drugs. You can say directly acting muscarinic receptor and directly nicotinic, and after that indirectly acting cholinergic agonist. Okay, so directly acting pilocarpine and the acetylcholine, beta-quinol, carbicol, and that are induced directly on the muscarinic receptor, that is known as muscarinic agonist, and directly acting nicotinic receptor, nicotines, that drugs, the directly acting nicotinic receptor, and then okay, after that the indirectly acting, that discussed in the previous class also, indirectly acting, that having the prototype neostigmine, and that is the different type of drug, physoestigmine, and in reversible some irreversible that also, that is also known as neostigmine. So these drugs are known as anticholinesterase. Remember, anticholinesterase means it broken down the cholinesterase enzyme that help to the protect the acetylcholine, and their action is enhanced. That's why that is known as indirectly. Why these drugs are known as indirectly acting? Because that can't bind to the muscarinic or nicotinic receptor, but only broken down and inhibit the cholinesterase enzyme. That's why known as indirectly cholinergic drug. Drug you can say indirectly acting cholinergic agonist. Next slide. On the basis of their locations and their action, pharmacological action are cholinergic drug means parasympathomimetic, I can say the cholinergic drug that act to the directly in a different part, that the whether we call different drug having the action, that how to act on a in a pharmacological action. You can study in the what is the effect of the drug in a different part of the body, that is the pharmacological action of the drug, and this action is so on the basis of where the receptor are located, that is muscarinic or nicotinic. Okay. In a muscarinic receptor, the different location we mentioned, like M2 receptor is present in a cardiac muscle. If the cyclic MP inhibited, means open the potassium channel, means dephosphorylation of cyclic MP. It means relaxation of what? Reduce the cardiac output, reduce the heart rate, heartbeat, and that are reduced due to the muscarinic M2 receptor. And other different type glands like bowel movement, smooth muscles gland, glaucoma and meiosis in the eye that occur, sweating, tears, salivations, different, all the things are increasing secretion of the their gland content. मतलब सभी ग्लैंड्स का सिक्रेशन इन्हांस होता है एंड जो है कार्डियक मसल रिलैक्स करती है. मतलब यू कैन से द सिक्रेशन में जैसे आई में मायोसिस है तो उसमें जो इक्वेसिमर का सिक्रेशन बढ़ जाएगा, स्लाइवेशन ज़्यादा होगा, स्वेटिंग ज़्यादा होगा, ग्लैंड का सिक्रेशन सब बढ़ जाते हैं. हाँ, बोबल मूवमेंट बढ़ेगा. ओके, सभी कुछ इसमें बढ़ जाएगा, बस केवल कार्डियक मसल रिलैक्स होती है. क्यों? क्योंकि ये M2 रिसेप्टर पाया जाता है. ये जो है साइक्लिक MP पाथवे से एक्ट करता है, जिसमें पोटेशियम चैनल ओपन होता है, जिसको GI रिसेप्टर बोलता है. तो ओपन होता है, जब रिसेप्टर ओपन होगा तो पोटेशियम चैनल ओपन होगा तो हाइपोपोलर डिफॉस्फोराइज हो जाएगा. तो जहाँ पे हार्ट एगोनिस्ट पे कांटेक्ट होता था वहाँ पे रिलैक्स होगा, जिससे कार्डियक आउटपुट, हार्ट रेट, सब कुछ हार्ट की एक्टिविटी घट जाती है, मतलब डिक्रीज हो जाती है. और सभी ग्लैंड्स जैसे ब्लड, जैसे स्वेट ग्लैंड्स, स्वेटिंग, मायोसिस, अस्थमा, वो सभी ग्लैंड्स के एक्शन जो है वो इन्हांस हो गए और सबका सिक्रेशन बढ़ता है, पेरिस्टाल्टिस मूवमेंट भी बढ़ता है, सब कुछ बढ़ता है. और दैट इज acting indirectly, drug anticholinergic, neurotransmission, ये सब no action in CNS penetration because these drugs are not passing in the brain due to the barrier of blood-brain barrier. That's why not pass the CNS, but that's why not induce any effect on the brain, but it act in a myasthenia gravis. Myasthenia gravis is a disease in a joints. You can use the neurotransmission for treatment. That topic discussion in the next portion of the slide. Okay, previous slide. Okay, this is the next slide. Previous slide. Physiotechnique are CNS activity and different activity is there. Glaucoma and also treated by this portion. Okay. In the next slide, you can this portion are discussed on the anticholinergic drug, that is known as cholinesterase inhibitors. Okay, that also part of the cholinesterase inhibitors. Malathion, organophosphate, and antidote, that is known as the drugs indirectly acting. Okay, and that portion of the anticholinergic drug. It discussed in the next slide. Okay, thank you for all for attention.